Now, I don't want to panic you, but for those of us who are on Medicare, time is rapidly running out. Open enrollment ends on December 7th. Now, by then, we must choose a supplemental insurance plan to cover the things that Medicare doesn't, and a prescription drug plan. There are an overwhelming number of those plans out there to choose from, and they're often very complex. It's a very good idea to get assistance from an expert, and we've asked Cesar Chacon, the agency owner and the licensed broker with the Insurance Hub, to give us a little help here. Cesar, where should we go for help?
Well, thanks for having me again. I appreciate that. Well, you're right. That time is of the essence. It's December 7th is the cutoff, right, where you can make that change if you like. For procrastinators out there, I really don't want to say this, but I guess I have to, that in January 1st there's what's called an open enrollment period from January 1st through March 31st to make any changes. But as far as choosing a plan or making sure you're in the right plan or asking the right questions, I think it's important to ask a broker, and I think it's important to ask an independent broker versus a captive broker. There's nothing wrong with a captive broker except that they only represent one company.
So they really can't give you the choices. And one thing I have learned, I thought I had this problem all solved. You choose a company, I did that last year, but you can't go with what you had last year because plans change and so does life.
Yeah, I had mentioned before that one of the most important things that change from year to year are prescription drug plans. And it's a number of different reasons. We have different changes to our health, different medications that come as part of that. Physicians hear about a new drug they want to try out. There are different reasons why you should just look at your review your plan every year, and it's important that that you take a look at that with, I would say, an expert, if you will, an insurance broker that can kind of look at all your medications, your physicians, and your plan as far as what you have on hand at the moment.
But how much is that going to cost me if I sit down with someone like you and get your guidance? How much is that going to cost?
Well, we're licensed insurance agents. We get paid by the different programs that we represent. Again, if we're independent brokers, we get paid by the different carriers that are out there, as opposed to a captive agent that only gets paid by one carrier.
So it's not going to cost me anything to get your advice?
No, it doesn't cost you anything. It's the best idea. If I can mention this, there are a lot of resources that y'all have. There's the Medicare and You Handbook that y'all receive every year. It's 150 some pages of blah blah blah. You go through that.
I've never read one of those, and I've been on Medicare forever.
And then the Medicare.gov is out there where you can kind of maneuver and put your medications in there. But then the problem with a lot of that stuff when you're looking at prescription drug plans is that CVS may cost you different than Walgreens versus Walmart versus Publix as far as their pharmacies are concerned. And so what we take a look at is your whole list of medications, and we say, well, listen, it's better here, it's better there. And in some cases, hate to say it, GoodRx tends to be a better option than your Medicare plan.
That's very interesting because it's so confusing. I do have all that paperwork. I don't get it, and I'll read that, but I need somebody to explain to me what I'm reading. Now, my neighbors are very happy to do that, but what they're using may be totally wrong for me, right?
Right. There's a lot of noise that y'all get in the mail. It gets, sometimes I'll go and there's a stack of papers on somebody's kitchen table, and you'll always hear that neighbor or that one person or that client's like, hey, my neighbor has this, and it really works well for her, and I would love to have that, and it doesn't work for them because of their medications. Their physicians may not be in the network, and so we try and just say, okay, listen, it's an individual product. Let's sit down and take a look at your situation. And by the time we're done, we're like, oh yeah, I don't want that one. I want this one.
So it boils down to there is one that's just right for you.
That is correct.
But what are some things to look for and to look out for when we're shopping for this?
Yeah, the biggest thing, as I've mentioned before, are the prescription drugs. Because when it comes down to health plans, Medicare is a really, really good program. Co-pays, physicians and so forth. There's a lot of good things that are out there on the Medicare plans. The prescription drugs themselves are very difficult to maneuver, And that is the one thing I keep telling folks, you got to really look at your prescription drug plans or your medications through a Medicare Advantage plan or through your standalone prescription drug plan. As I mentioned before, there's 22 standalone prescription drug plans out there. So it's important to kind of look at your medication list, compare it to what's out there. And the best thing to do is just call an expert and just let them help you out with that.
I totally agree. Thank you so much. And to find more information about Medicare Supplement and prescription drug coverage, or to talk to an expert to help you figure out what's best for you, you can go to theinsurancehub.net. And you can call 941-706-1111. We'll be right back.